Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist, and in this video I want to share with you 4 reasons why you should not massage your painful piriformis muscle and/or sciatic nerve if you have some form of back, butt, and/or sciatica problem. And I feel it's useful to share this in a world where everyone is recommending to use massage guns, foam rollers, lacrosse balls, spiky balls, things like that to, dig deep into the glute and the leg and things like that to release these problems. It's probably useful to know when you maybe don't want to do that. So I'm going to be somebody who goes against the grain and shares with you, again, why I would not recommend massaging your painful back, butt, or leg. For those of you who are new to my channel, again, my name is Dr. Charlie Johnson. I am a physical therapist. I have my board specialty in orthopedics, and I help people all around the world resolve their back, butt, and sciatica problems naturally so that they don't have to rely on other people to fix them, and they can avoid pill shots or surgery. And finally, in this video, we're not going to talk about how to know if you have piriformis syndrome and or sciatica. I've done a whole flow chart and outlined my whole algorithm for how I figure that out in my DIY diagnostic guide. You can download that above. Check it out. Again, it lets you inside my brain and tells you exactly, how to go through specific tests and kind of how to know, again, what could be going on. All right, so reason number 1, the first reason that you should not massage your painful area is that massage triggers pain, not trigger points. All right, so look, there's no doubt there's something painful in your back, butt, or leg, sore spots, if you will, in that area, right? They hurt when you poke on them. And look, in an effort to translate what we feel into words, right, we've labeled these sore spots as trigger points, tender points, muscle knots, things like that, right? And then based off these labels or beliefs, many people try to release these trigger points or these knots, right, by rubbing them out and massaging them again with spiky balls and massage guns and things like that. And yet what's very interesting is that there's no evidence to suggest that treating them as such, as trigger points, as knots, and trying to work through them works any better than just leaving them alone. In fact, I would argue that poking the painful spots only further irritates your problem and sensitizes the area that hurts. So what I'm suggesting is that we relabel these trigger points as just sore spots or areas of the body that are sensitive and hurt. And so consider that if you've been sitting on a tennis ball, a spiky ball, a foam roller, using massage gun, getting, deep tissue, if you will, the people's elbow to your buttock area, and it's not working, you may just be consistently triggering your pain, not releasing trigger points. So my recommendation is that if something hurts so good, don't do it. If you want to feel good, give yourself more good inputs, more yummy inputs, more things that feel good to your body, not things that hurt so good. Because if they hurt so good, they still hurt. So the second reason I do not recommend using massage to solve these problems is because massage fuels pain with fear and attention. So how you feel should be based off of how you feel, not what they feel. All right, so if you're paying for a professional massage, you have to be careful about who you choose. Let me explain. Right? Recently, I had a woman inside of my private coaching program. We track progress weekly. I actually share what I call a private healing log with people, and we track progress week to week. And we put some numbers to it. We objectify the experience, because when you're in pain, it's very easy to become emotional. We want to make decisions based off logic, not off emotion. All right? And so when we track things weekly, we can see if somebody's improving, so they're getting better. They're staying the same, so they're a little stuck, or they're getting worse. And either is okay, because then we can decide what's happening and where to go from there. We can make decisions with clarity, not with confusion or with emotion, all right? So there was a woman inside the program who had a better trend. She was getting better until she saw her massage therapist. And her massage therapist said, "Hey, you are super tight. What happened? I thought you were going to PT, right? I thought you were getting better." Interesting. So this person's getting better on paper, and they say they're getting better, but then they go to their massage therapist, and the massage therapist says, "Hey, you're super tight, what's happening?" And then that person sends me a message and says, "Hey, I thought I was getting better, but I guess I'm not." Crazy stuff, all right? Or, on the other end of the spectrum, there was a woman who from a certain point, week to week, was a little stuck, staying the same. She wasn't noticing an improvement in how she could, walk or sleep or bend or things like that. And her motion quality still stayed the same. So she was the same. And so we needed to change, and we could tell that. But then she went to her massage therapist. And the massage therapist said, "Wow, you are so loose. What you're doing must be working." And that resulted in her sending me a message that said, "Hey, we must be on the right track. Looks like I'm getting better. When she wasn't, she was stuck. All right, so look, this just goes to show the power, right, of words and emotions. And so the solution to getting wrapped up in sort of what others are saying is data over dogma. So dogma is just something stated by an authority figure that you accept to be true. And how you feel or how you think you're doing is based off of that which a massage therapist tells you, or a chiropractor tells you, or your doctor tells you, or your friend tells you, or whoever, right? Something external to you. Then you're out of control, right? So instead, I want you to come up with some way to objectively measure what's happening, all right? And I want you to take what others are saying with a grain of salt. And week to week, you should be looking at your progress saying, same, better, worse, same, better, worse, and having some way to quantify or objectify that so you know you're heading in the right direction, you're stuck, or you need to change because you're going in the wrong direction, all right? So this way you can stay logical, not emotional, all right? When you're in pain, you go insane. It's not your fault. So the ultimate goal, though, of doing this work, okay, of tracking your progress is to remain logical and have a sense of clarity versus emotional and feeling chaotic. So hopefully that makes sense. The third reason why I do not recommend using massage for these problems, okay, is that massage often treats the symptoms, not the source. So look, if you feel pain in your back, butt, or leg, chances are they're not the real source of the symptoms. They're just the symptoms, which is a secondary effect of your pain experience, right? So you might actually feel the pain in your back or your butt or your leg, right? But chances are it's referred from somewhere else. Maybe somewhere in your back, or maybe the brain, or maybe it's a nerve problem that's causing your calf and your hamstring and your butt to feel so tight and you think you want to massage it out, but your nerve is actually highly sensitive. And this brings me to my fourth and final point. Massage intentionally compresses the sciatic nerve. Massage might work for a little bit of a kink in the shoulder, or I don't know, in the chest, or in the thigh after a hard workout or something like that, but you're dealing with a hotbed of the nervous system that goes right from the back, goes through the buttock, right, the biggest nerve in the body, and you're intentionally compressing it. If you're using a massage gun, if you're paying and getting massage into the buttock, if you're using a lacrosse ball, if you're sitting on a foam roller, rolling on spiky balls, you're intentionally compressing the sciatic nerve, which reduces blood supply. Guess what the blood carries? Oxygen and nutrients that allow the body to heal, right? And if you're doing this intentionally, then you're just creating more sensitivity within the nervous system, and you're making your sciatic nerve and the area around it more angry. So look, I'm not saying massage never works. I can see it now in the comments, right? Like, massage worked for me. Great. You can absolutely try it, but just realize that if it does help, then great, keep doing it. But it's probably not doing so for the reasons that you've been led to believe. Working out the knots, working out the trigger points, etc. If it's not working, consider that one of these 4 reasons, right, that we chatted about today might be why. And it's probably time to ditch the massage and try something new. And of course, if you don't believe me, go ahead, give it a try, follow suit with what everybody else is recommending. Just be sure to listen to your body, not what other people say. So many times people say like, hey, it should hurt so good, it's gonna hurt before you get better. No pain, no gain, right? And when you make that grimace when someone puts their elbow into your buttock, or when you're rolling on the foam roller, you make that foam roller face, right? A lot of people kind of chuckle at that, like it's a good thing, but like you're just adding insult to injury. In my experience. If you don't believe me, go ahead, try it out. That being said, let me know your thoughts and your experience with massage for these, butt, piriformis, sciatica problems. Let me know, did it work, did it not? Let me know if I'm crazy, thinking too outside the box, but let me know again in the comments. Also, if you like this video, shoot me a thumbs up. Also, be sure to subscribe, hit the bell for notifications when I create videos every single week. Thanks so much, everyone, and chat soon.